Greetings. My name is Shawn Jackman. I'm the founder and CEO of Clinical Mobility. We are everything wireless in healthcare, and we are working to solve the wireless reliability problem that we all seek as the world is more and more mobile and digital health is more and more upon us. We have to change our approach for how we roll out mobility. These are some techniques that we've used in our careers and we use as a practice with clinical mobility. And we hope that if you exercise these, you're going to improve your environment. So let's get into it. Healthcare IT, it's a very wide area in breadth. We have clinical technology that most people don't consider necessarily IT, which is the HCM professionals. And then you have all of these clinical software systems like the electronic health records, medical records that run the hospitals. You have systems that are used inside the hospitals like nurse call. You have all of these things that traditional IT doesn't always have these. And there's not always clear accountability in who the owners are for a lot of these. In general, in healthcare IT, the first thing that we need to do that we often do not do is to understand the problem. What do you mean by that? Try to summarize what you're being asked and why they're asking for your help with something. Try to summarize that in one sentence. Write a problem statement. So if somebody comes to you and says, hey Shawn, we want to deploy these new widgets. We want to put them on the network. And the more that you understand why are they asking for these widgets? What do they do? What's the clinical value to these? Oftentimes, IT people go, man, another device. Well, you didn't consult me. I was hoping that we were going to partner about before you purchase things. It's a valid frustration, but flip it around a little bit. Try to understand what clinical problem they're trying to solve. And as a reminder, we're doing this because we're all in healthcare. We're trying to improve people's lives. That's what matters. So understand the business value of how this makes people healthier, recover faster, whatever the business need is, and how it affects your healthcare organization's bottom line. The more that you understand that, you can then start going on this journey that really begins with this. So we're going to have a series of content, several different pieces, and some of them will be able to be viewed out of order for this, but it all starts with the problem statement. And sometimes you might get longer sentences or multi-part sentences, and that's okay. But the key is understanding it from a non-technical point of view, what business issue exists. And now as IT, you can start to understand the business problem and then oftentimes think about the solution that you're going to provide or that you were thinking about providing in a different way. And we're going to go through this journey together over this series, but it all starts with a problem statement. And I'll give you one example before we end this. I'd like to use wireless guest access. It's Wi-Fi hotspot when you're in a hospital. So if you get asked to do this, and we're all doing this now, we feel like we're in the I like to say we're in the hospitality business, like hotels are, and it's really around allowing patients to stay connected to the outside world when they're visiting, but that includes family members. And by the way, that's now grown to bring your own device. Maybe it's a variant of guest access. Maybe there's some soft areas that you can blend there in terms of authorization privileges. It's a host of things. So we need some type of connectivity to the outside world for a whole bunch of stakeholders. And we're going to dive into who stakeholders are and what are some use cases around that, and then what kind of requirements can we ferret out of this so that we can then build an architect, really a solution that addresses the business problem. So that's all we have for you today. This is a good start. Hopefully it's a teaser for a lot more content to come. We look forward to hearing your feedback and would love a conversation. Again, Shawn Jackman with Clinical Mobility. Thank you so much.